I think the clinical skills that are unique to forensic nursing is you have to be good at physical assessment. And it's recommended that you practice as a nurse for a few years before you even begin to become a forensic nurse. Because often we are acting as we are the lone person and we are sort of the consultant and considered the expert. So you have to be able to assess a patient's body. You have to know the classic signs and symptoms of injuries. You have to know that certain injuries you see might indicate that the patient was non-fatally strangled, even if the patient never mentions that. So you have to be on the lookout for signs and symptoms and then be able to not only meet the patient's medical needs as it relates to those signs and symptoms, but be able to kind of ask in a very compassionate, trauma-informed way how the patient got that injury. Does the patient know what happened? Does the patient remember what happened? And so you have to really know what's normal for the body and what's probably abnormal and be able to zero in on anything that's of concern. We have the title forensic nurse, but we are nurses first. And our goal is to provide health care. And we know that there are short-term consequences of being a victim of violence, but there are also long-term consequences. And so those are always in the back of our mind with everything that we do for that patient. When I meet patients and I begin to do an exam, I explain to my patients that I need to look everywhere they have skin. So I'm basically looking over the entire body. I will get a history from my patient as the type of contacts with her body, and that will tell me where to zero in on their body for potential evidence collection, but also for potential injury. So, for other words, as far as the female external genitalia, I need to know what normal looks like so that if there's something that's abnormal, I can point it out to the patient. Often, when I take care of patients, they don't really understand what normal is. And so it's a great opportunity for teaching. This is healthy tissue. This is normal tissue. This is nothing to be concerned about. This is just how your body looks. Or I can say, well, I see something here that looks a little bit like it might not have been there before this happened. Do you recall how this happened? Like I might see a purple area on the thigh, a bruise. And I might say, do you recall how this happened? Because I know that there shouldn't normally be purple areas on the thighs. And so it just really, the patient is depending on me to let them know that they're healthy, or if I see an injury, how that injury needs to be cared for, and then what can they can expect from the outcome of the injury. I also need to be aware that there are certain infections that patients can be exposed to. So I need to be able to briefly talk about those infections and then offer medications that we have and protocols that we have that could prevent the patient from getting those infections. So you really have to know good assessment skills and you have to stay educated because things change. The way I examine a patient now is not how I did it when I started 28 years ago. There are advances in science and there are advances in the ability to find DNA that we just didn't know about when I started years ago. And so those are the major skills you need as far as assessment. When I first started, we would examine patients up to 72 hours after the event. That's 3 days, because it was thought at the time that the likelihood that evidence would be on or in their body after 3 days was very limited and very low. Back then, you needed quite a bit of evidence in order for the crime lab to even develop a DNA profile. Nowadays, DNA profiles can be developed from minuscule, like what fits on the head of a pin, types of DNA evidence. We know that DNA and other types of evidence can be found all over the body, inside and outside. We know based on research that evidence stays in the body a lot longer than 3 days or 72 hours. A lot of programs are moving toward 5 days and 100 or 120 hours with which to offer evidence collection from patients. We also now can collect evidence just if one person touches another person in a particular area. It used to be that we were looking for body fluids years ago. Now I ask my patient all types of questions about the different types of contact with their body. And anywhere my patient tells me there was contact with her or his body, then I know that those areas should be swabbed for retrieval of potential evidence, whether it's body fluids or skin cells. You learn by having interactions with, for example, a criminalist or a person who works in a crime lab, because this is how you learn. You really become very informed and educated, and this happens year after year after year because things do change.